want to welcome to our studios here at Calabash TV, Dr. Jacqueline and also Sophia Harry. And we're here to talk to members of the Sinister Sickle Cell Association. September is the month set aside to observe and to discuss, to create a greater awareness of sickle cell. So welcome to Calabash TV, Dr. Bird and Ms. Harry.
Thank you.
Ms. Harry, you're the president of
sir.
the Sinister Sickle Cell Association, and there's a big anniversary that you have as well.
Yes.
So we'll cover that and also talk a little bit about the issue itself, sickle cell, and the status in St. Lucia. And we've known of it for a very, very long time. When Paula Cauldron initiated the discussions and awareness programs in St. Lucia, she did engage us in the media, and so we got to probably some of us got to hear it for the first time. So, Ms. Harry, let's start with you first. We know you have had some direct experiences with it. So, first of all, give us an idea, when did you first hear of sickle cell and when did it impact you?
Okay. The first I heard of sickle cell was on television. In those days, there was a song. It was called Good to Know You Care. And I just used to look at it. And lo and behold, one day, my son, at the age of 8 years of age, I noticed he had, his fingers were swollen, his toes were swollen. So I took him to Dr. Simmons at the time. We did a test, and he was diagnosed with sickle cell disease, full blown.
So it wasn't at birth, it was 8 months later.
That's what I got to know about. Yes, 8 months. Yeah.
All right, so Dr. Bird, so I don't want to introduce Ms. Harry and then talk to you in terms of the sickle cell itself. What exactly is it, and what some of us who don't know, what are some of the symptoms we need to look out for?
Sickle cell disease is a range of disorders, a family of disorders related to a single gene mutation in a gene that determines the type of hemoglobin or protein that you carry in your red blood cells. So it is a chronic disorder affecting the red blood cells. It affects the red blood cells in a way that they become hard and crystalline and difficult to transmit through small blood vessels.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
So, in essence, the main symptom is blockage of those blood vessels and removal of the red blood cells by the body, which is very efficient at cleaning itself of pathogens and, invading things. So it's a chronic anemia. There's low blood. That's the most overriding symptom. There is pain because blood cells get blocked, so oxygen is deficient in the tissues, and there's pain especially in long bones, in the chest, in the abdomen. There are many other severe complications of the breakdown of blood, like jaundice and gallstones. And because of the blood circulation issues, there are severe life-threatening complications like stroke. It's the commonest cause of stroke in children. If you have a 5-year-old who collapses with a stroke, they have sickle cell disease until proven otherwise. And of course, the other life-threatening complication is in the lung when you get what we call an acute chest syndrome that looks like, to all intents and purposes, like a pneumonia, because the kid comes in with fever, shortness of breath, and the x-ray looks like a pneumonia, but you die much more quickly than you do from a pneumonia because it's actually a sickle cell infarction in the lungs, an acute chest syndrome. They're also at risk of lots of other infections because the spleen that gets blocked, choked from these cells, is where we manufacture a lot of chemicals that fight infections. So they're at risk of meningitis, pneumonia, osteomyelitis, the long bones, and basically lots of other life-threatening complications.
So, Ms. Harry, when you, your son, when you got diagnosed at 8 months and so on, and you saw his hands were swollen. Was he in pain? What are some of the discomforts that he was experiencing?
Mainly pain. He would get like weak at times. Yes, but during his early stages, like his infant, well, yes, from say like 1 to 3 years of age, he was a normal child. But you know, when when he would get a crisis, that is the only time he would be sick. Because I used to say, you think that child have sickle cell because he was such an active child. But at the age of 4 years, that is when he got the stroke. And it was like a seizure. And it's like he's saying to me, Mommy, look at that, look at that. It's like a joke. And you know, his one side of his face was twitching and his hands. So I took him to the hospital. And I didn't even know he had a stroke until long after. You know, in those days, the doctors didn't really tell you exactly what was going on. And you know that's a doctor, so you don't really ask questions. But now I know better that you have to ask a lot of questions, you know. Yes.
Dr. Ed, obviously, you should, well, I guess now we have to encourage anybody who shows up to ask more questions. I guess that's part of the routine now if you go.
Absolutely, and that's part of what has sort of been transformed, not just in sickle cell disease, but in all other conditions. Our care for people and children with sickle cell disease has transformed the care we offer in other conditions. And the patient advocacy is one of our strongest arms of support. We insist that parents know their status, that parents understand what it means to have a sickle cell trait, to know the risk, which is a 25% chance when you have 2 people with each having a trait. And we insist that they recognize they are the doctors at their homes, because they have to be first off the bat with the complications, which often move very rapidly and threaten life. They have to know what a stroke looks like, and they have to know what you can do about it, so they don't stay at home rubbing with turpentine, which was the situation back in those days.
So when you say know your status, how do you get to know that you're sick?
Well, it's a blood test. You do a blood test called a hemoglobin electrophoresis. For short, we call it the sickle cell test. It is not that expensive a test in the realm of lab tests. It costs, I think, between $15 and $35. And it is actually offered to pregnant women in our antenatal service.
It's currently offered now.
Yes, because it's part of that battery of tests that they know they have to do, including HIV, hepatitis B. One of them is your sickle cell test or your hemoglobin electrophoresis. And it tells you if you're an adult without sickle cell disease, your status is AA. If you're a person with a trait, you're AS or AC, because there are many other forms of sickle cell, by the way, not other than SS. SS is the most severe. And if you're a sickler, your hemoglobin SS or SC or S-beta thalassemia. So as soon as you do the blood test, you can know your status. And in fact, before you plan a pregnancy, there are many things you should know. And one of the most important is your sickle cell status. And if you have a trait, it is critical to know the status of your partner, because you're playing Russian roulette if you go into a pregnancy knowing you have a trait and not knowing your partner's status, because you have a 1 in 4 chance of every pregnancy with that partner having a full-blown sickle cell disease child.
Sophia, so once you had realized that you're taking your son to the doctor and you had the situation at 4, how did you start to reorient your thinking about it? Did you panic? What exactly was your response, your reaction to it?
Well, at first, I didn't panic because, like I said, my son was like a normal child in the beginning. I'm somebody that if I encounter problems, I don't panic one time, because I believe if you panic, everything falls apart. So I always get information, you know. First I get information, and I go to the persons responsible. So I was always a member of the St. Lucia Sickle Cell Association. In those days, Nurse Wilson used to be there, and she helped me a lot, you know. And through the Sickle Cell Association, I was able to get more help for my son in that regard.
So Sophia is famous, and so is her son, Shandell. They are the first, he is the first patient with sickle cell disease, and probably still the only one in the English-speaking Caribbean that has received a bone marrow transplant, curing him of his sickle cell disease. He was 8 at the time, was he?
Four.
Sorry, 4
Yeah.
years old at the time. So through the St. Lucia Sickle Cell Association, which again, I have to keep underlining, is the strongest patient advocacy group in St. Lucia still today, since its formation in 1987 by Mrs. Paula Cauldron. They were able, through contacts overseas with St. Jude's Hospital, Children's Hospital in Memphis, because they had a bone marrow protocol, a research program doing the bone marrow transplant, and he was accepted. And thankfully, was it you or your daughter that was a match?
My son, his firstborn.
Or your first child
son.
was a match, because you can't just have a placement in a protocol, you need a match for the bone marrow transplant.
Okay, so just explain. So your first son doesn't have sickle cell?
Yeah,
The trait.
he would.
He had
Well,
the trait.
I cannot say he had the trait. I never did any tests for him. So,
But he's
so
fine.
but he's okay. Yes, he was the one who was
He
a
was a
perfect
match
match.
for the-
Yes,
for the
he
marrow.
was a donor.
Yeah. So, Doc,
Yes.
if the bone marrow transplant works so well, why aren't we having that as a matter of course, a matter of treatment?
Oh, because in the days, that was 1995, in the
Yes,
days when Chandel had his bone marrow transplant, this was a life-threatening procedure that rescued you from the brink of doom because of your disease. So you were between the devil and the deep blue sea in those days. There was a 50% mortality. You went in knowing it is 50% chance you will not survive it, because a bone marrow transplant is a very serious procedure. You have to remove the patient's bone marrow, and first of all, you have to kill it, not remove it. You have to kill it with chemotherapy drugs and replace it in a very protected environment with the donor's marrow, and pray that it takes. Just like a kidney transplant, you pray that you don't get a rejection by the patient. So he's under heavy manners in terms of medication, steroids, immunosuppressant drugs. You can't go near him, he can't have visitors, and it has to be overseas for an extended period of time. I can't remember how much it was cost. It was probably over $50,000 US in those
Yes,
days.
In those days.
I don't know what it costs now. The cost
Plus-
might have come down with the improvement in technology and so on. They've simplified things a bit, and they're offering some patients stem cell transplants, in which, some people save their stem cells from newborns or even themselves. They harvest stem cells and you can use those. So things have improved on that front, but we are still not eligible here in St. Lucia in the Caribbean unless there's a research program going on, to get into a research program. It's too expensive.
So the cost is the main issue for us in the Caribbean.
Yes. And we're not doing those in the Caribbean at the moment.
So once your son had the bone marrow transplant and he got cured of it, did he get back to his active, normal lifestyle?
Yes. Yes, he stayed about 11 and a half months with that program. So during that time, he had, he was weak. And even now, he has a disability. He has a limp. Like Dr. Bill said earlier, children at the age of 40, some persons get stroke. He was one of them who got a stroke. Right? So.
Yes, because the bone marrow doesn't cure the stroke. The damage to the brain has already been done. Yeah.
So Doc, is it something that you can have an onset of it later on in life? I mean, you realize it at 4, but like a 14-year-old or even an older person can have it discovered later on in life?
Oh, yes. There's a varying, it's such a complex disease because there's a varying genetic profile. And let us say, for example, that you have inherited an S from one parent and a C from another parent. That is a milder clinical form of sickle cell disease. And they have many people that exist, some of them into adulthood, without recognizing that you are a sickler. You have hemoglobin SC disease. And the medical profession has to accept some of that blame, because many times we ourselves were confused with the typing and the genetic diagnosis. And we have told people with SC, you don't have sickle cell, you only have the trait, before we recognized that C was as much a form of sickle cell as the S hemoglobin. So that's one reason why some people present late. Some people also have a persistence of the fetal hemoglobin, the one that you're born with. hemoglobin F that usually subsides at around 6 months of age. And that's why she didn't have a clue until her son was 8 months and presented with what we call dactylitis, which is sickling in the small bones of the fingers and toes, because he was protected by hemoglobin F until about that time. And when that falls off, as it does naturally, your S becomes your only hemoglobin, and boom, that's when your complications start. Some people are blessed to have a hereditary persistence of F. So you'll have an adult whose test says SS with F, and they sometimes don't even know they have sickle cell because the F protects you from some of those complications associated with S. That has really led to a breakthrough treatment for sickle cell called hydroxyurea, which is an old, actually, chemotherapy drug for some people with a chronic form of white cell cancer, white blood cell cancer. We find that it pushes the hemoglobin F and it helps you to raise your hemoglobin F levels and actually stabilizes a lot of the complications. And it's actually one of the biggest things, breakthroughs in the last 15 years to prevent stroke in children, putting them on this medication. Some of them forget they have sickle cell.
So, Ms. Ari, as president of the association, obviously part of your mandate would be awareness. You have a big anniversary, so you've been around, you've been able to sustain the organization. What is the key message that you want to get out there as part of your advocacy, part of your awareness to the general public? Because most of us watching this interview may not have any idea what exactly it is, and some of us may be carriers, I don't know exactly what the term is. But what is the key message to persons like us who need to know more?
Okay, what I would like to say to the public is to know your status. Like Dr. Bird always say, know your status. Especially to the young persons out there, when you're ready to choose your partner, make sure you know the status of your partner and the two of you do the test so that you know. I always tell my sons that. I have 3 sons, and because I know it runs in the family, you always tell them, make sure you take a test, your partner take a test. You don't want to know down the road that the two of you is carrying the trait, or maybe one of the traits, and then you have a child and the child is full-blown sickle cell. It's a difficult situation for a parent to have a child with sickle cell, and some persons even have 2 children with sickle cell. It's not
3 and
easy.
4.
Yes, I can tell you. So know your status.
So, Dr. But it sounds like even marriage counselors and churches should start alerting people early that you need to know, because the cost can be and the pain, the experience of just having a child with sickle cell and the treatment and everything else can be quite a traumatic experience.
Oh yes, that should be a headlining discussion in marriage counseling, in health and family life education in the schools from the time they're in primary school. And most definitely with adolescents and youth. In the work that we do with youth, that's one of the strongest things I talk about, because it is so easy to sort out. You know your status. Now, having known your status, I'm not saying a couple cannot still decide to take a shot at it and have a child, but knowledge is power. So you go into it, and the other thing you do is that you, as soon as possible after the birth of your child, you need to know your child's sickle cell status. Now, we're fortunate in St. Lucia because, again, through the work of Mrs. Cauldron, and I just want to say a public thank you to her for the work that she did back in the days in 1987 and leading forwards with her advocacy, because it is the St. Lucia Sickle Cell Association that brought universal cord blood screening for sickle cell to St. Lucia. The machines that were put into the Ezra Long lab were through the work and the advocacy and the searching of Mrs. Cauldron. And it is the St. Lucia Sickle Cell Association and Nurse Sheila Wilson that used to daily, weekly go into the lab to look for the results of those tests. Because as you can imagine, Bernard, it's a test that sits in a ledger and may not be of interest to anybody, save those that are advocating for the patient. So Mrs. Wilson used to go to Victoria Hospital at least once a week to flip through this ledger and look for the positives, and then go home to call them and bring them into the association. And today we still do that. I still have to make phone calls as the community pediatrician up to 2017, I would make weekly phone calls to people, alerting them to the fact that you have just given birth to a baby that appears to have sickle cell disease, and you need to come in and confirm the baby's status and start your care. Because the care is different to a child that does not have sickle cell disease.
I was about to ask you about that. What exactly is it? First of all, what's the response?
Yes.
In this, and then what was the care?
Okay. The response is often quite shocking because people often don't even remember that they had a test and that it might have been positive. They come in to have the baby and haven't checked the result of the test that was done in the antenatal period. And maybe they have no knowledge the response is often, but I don't have that in my family. As soon as the diagnosis is made, the care is different. The children need an augmented immunization program. They get immunized against the leading cause of death in sickle cell, which is pneumococcal disease. That's a bacteria that causes pneumonia, meningitis, osteomyelitis. They have to take folic acid to help protect the blood, the chronic anemia. They have to take hydroxyurea later on after the age of 2. And they have to have frequent monitoring and different examinations and teaching of the parents to recognize the organs that can get enlarged and what are the complications to look out for and so on. So we have a comprehensive care program in the St. Lucia Sickle Cell Association. We started back in 1989 a community outreach program for sickle cell disease. So we sort of commanded and pirated the Ministry of Health's Community Child Health Service and piggybacked on it to bring care right out to where children live with sickle cell disease. So we would see them in Miku, Choiseul. I have vaccinated sicklers in gas stations in Choiseul, in churches, in schools, in Delcere, because that is what augmented care looks like. We can't wait for them to come from Delcere when it's raining. We have to go to them. And sickle cell disease was able to offer that model of community outreach to the HIV program, which came later.
So, Ms. Sari, in terms of, we just had Dr. Bud talking about the outreach and so on. Give us an idea of the support, because like everything else, all organizations need help in getting getting things done, because it's expensive. You have to drive, you have to find the resources, find the experts, and so on. What kind of agencies are you working with, and how much support are you getting to keep your awareness and your work going?
Okay, so in St. Lucia, we're basically trying our best to do things on our own. When we need assistance from different organizations, we ask and we get from certain persons. We get assistance. We also get assistance from NIC. NIC helps us a lot. We have assistance from CIBC. Occasionally we will get help from different sources. And on our own, what we do, we try to reach out to persons by doing visits. We do health center visits. We do door-to-door visits, because presently what we're going for right now is our list of our database. We have persons, and the numbers that we have for these persons, we no longer can reach these persons. So that's one of the reasons why I'm trying to find myself in the different health centers and leaving our information. So what I would like to say to the general public is, if you have the disease, or you know somebody suffering with that disease, and you normally go to the health centers, leave your information with the nurses, the community health aides, because we'll be going to the different health centers and collecting names and updating persons.
It sounds like quite a handful that you have, because the point I was trying to get at is in terms of resources. So even at your office, do you have an established office, and is it staffed with people who can help with the database, with the outreach, those kind of things?
Yes. At the office, we have a receptionist. We hired her last year, and she's doing a fantastic job. She's helping us to, reach out to our patients. We call on a monthly basis. We make a few calls, get our persons to come in to register, update their cards, and pay the registration fees.
Contact and so where the office is.
Yes, I should give you information on our. Yes. So right now our office is in the Cleary on Tapion Avenue. It is directly at the back of the Le Cleric Catholic Church. And we open on Mondays to Wednesdays. It's 9 to 2. And
Number?
our number, yes, our number is 453-1011 at the office. And we have our cell number, it's 485-2355. And this number you can call us at any time and any day.
For years, we operated out of the John Compton Highway Sickle Cell Clinic. And then everybody knows where Pizza used to be at the end of Bridge Street by the police station. We had a daily walk-in clinic there for years. Again, this was unprecedented in medical care, that you could have a free walk-in service, daily staffed by a nurse, supported by volunteer pediatricians on a regular basis, where affected families knew they could come in, not just to get medical care, although Sister Wilson was there every day, so she could examine you. We could help you with IV fluid, pain relief. We offered subsidized medications for the sicklers, Panadol, folic acid. This association and this clinic actually brought the augmented immunizations to St. Lucia for hepatitis B, meningitis, and pneumococcal disease. And it really, I really have to say again a thank you to Mrs. Cauldron for establishing that. She also was great with lobbying government, and we actually got the nurse's salary support from government, and with a salary disbursement every year. And I think we still get a subvention from government as an NGO for patient care. So the Ministry of Health is also great support.
I see in one of your note here, there's a Memphis, U.S.A. Sickle Cell Miracle Network. What is that, and what's the affiliation?
Yes, I think, well, that's one of the overseas sickle cell associations.
So they assist
in the U.S., yes. I think they gave a lot of support. We had 2 other patients that went for a potential bone marrow transplant. One of them was a St. Lucian, but she didn't get a match. And we actually gave that slot to a patient from St. Vincent. So St. Lucia has been responsible for the 2 bone marrow transplants in the English-speaking Caribbean. But it would be the support groups like that Memphis Association that would have helped with transportation and patient support and so on.
How critical is volunteer support to what you do? I know you devote a lot of your time to it, Dr. Bird, and so on. How critical is it to the survival of your organization to get volunteer support and help?
Okay, yes. We have, at the organization, we have, I will say that we do get our members. We have our
How many members do you have, roughly?
In the fundraising committee, we have about 15 members, 15 to 25 persons, but mainly 15 active persons. Yes, and we do our fundraising every year. We look forward to the fundraising. This year, although we had COVID, nevertheless, we did 2 yard sales. Yes, and we have a little problem in getting more members to come on board. And that is one of the things I'm working on. So that is why I go into the database and I find persons, call them up and find out in what ways can they help the association. Right? Yeah.
Doctor, but is it a number that's stabilizing in terms of persons affected with sickle cell, or is it a number that's increasing? Is it an alarming situation? How do we characterize that?
I think the future looks good for sickle cell, especially when we look back at the past. We have a steady rate of about 11% carriage rate, frequency of the gene, which translates into approximately 1 in every 300 babies may be born with SS disease. So if you look at our birth rate, which has gone down a bit over the years, but let's say round it off to 3,000 births a year, we expect to get about 10 children born with sickle cell disease every year. And that number has been pretty steady, both here and worldwide. But what is important, I think, is our awareness about the disease. And now I think most mothers, when they open their eyes the next day after the birth of their baby, that's often one of the first questions, especially if they have the trait. And I think people have come to expect the augmented care that we have managed to coordinate and develop for children with sickle cell disease. So most people, if they have a trait, by 6 to 8 weeks, they are plying us with the questions, what's my baby's status? And they know that from 8 weeks of age, the baby will veer off the usual well baby care path to have that augmented care that we offer. I think we can boast that we do quite well with the model of care that we have, the patient advocacy that we have, the community outreach that we have, and the My Doctor. You know, people with sickle cell disease have my cell phone number on their WhatsApp, and they know that even though I'm no longer the community pediatrician, they can arrive at my door. There's no need for an appointment. They can arrive at my private office. There's no need for a public clinic if it's closed that day. And that's the level of care they've come to expect, and I think it's good.
Ms. Ari, what do you want the public to do to help the Sickle Cell Association?
Okay. To the listening public out there, we would like to raise the awareness of the disease, and we would like the entire public to know that sickle cell disease is a disease that really is a painful thing. And we have lots of persons out there needing great help. Some persons out there needing medical assistance, some persons out there needing financial assistance, especially what's happening these days with COVID. Many persons have lost jobs. So one of the challenges that we have is to meet the needs of all of our members who come to us for help. So what we're asking the public out there is to give up their time and maybe, you know, do a little volunteering, volunteer, sponsor, donate to the cause.
Now, I noticed the theme for this year is Sickle Cell Matters. And I noticed you're wearing red. I think I saw a red. Is it the color this year?
I heard somebody say burgundy.
Are we colorblind, so we're not quite sure what is it?
No, it's always because of the red blood. It's a blood disease.
Yeah.
Yes. Yeah. But the Sickle Cell Association just to support Sophia, and I really have to congratulate her because she took over. Mrs. Paula Cauldron led the helm for 30 years as president, and Sophia took over 3 years ago?
2 years now.
2 years ago, and she really has gone to extra lengths to personalize it and to bring members in, like into a family. You haven't told Bernard about your summer camps for your children and your craft workshops, your art workshops. It's even more than about medical care. It's about supporting patients who live with a often quite terrifying and terrible and painful disease. Children still die prematurely from sickle cell disease, especially young adults. And it shortens lifespan still, and it gives burdens that, you know, people shouldn't even have to live with. So the extra care that is going on with the association and the social life, I think, is quite important.
And the median age of death is still around 40 years?
I think it's been extended to the late 50s, especially with these new therapies like hydroxyurea and so on. And it's going to be extended further. It's going to take a while for those positive benefits to trickle down to our part of the world. But it's good.
Yeah.
Things look good.
Things look good. And when I was asking about how can the public assist, I noticed that members of the public can give blood as well. Is that one way that we can assist?
Oh yes, patients with sickle cell disease need blood more than the average person. So improving our blood bank capacity is one of the ways that's a very good suggestion that the public can help. One of the ways to intervene with a stroke and to save a brain of a stroking child is for blood transfusion. In other countries, you are supported after a stroke or to prevent a stroke by being enrolled in what they call a transfusion program. So every month you go in and have your blood replaced with non-sickle cell blood, and that lowers your percentage of S and minimizes your stroke risk. We cannot support that transfusion program here because we do not have as efficient as we need blood service. So that is really one of the things our sicklers suffer from. They are still too much at risk of stroke because of the deficiency of our blood bank service.
Ms. Ari, finally, in terms of, we're in September. Are there still activities yet to come? What exactly you have
Okay,
for the
so
remaining September?
for the remaining month, we have a free virtual art program going on for our members. You know, just a little fun. And we also have planned a games night with just a few persons. Because of COVID, we don't want to, you know, yes. So we do have a games night. We're planning to have maybe another yard sale because that helps a lot. And we're also distributing literature so that person, like in the different health centers, we distribute literature so persons know. We do a little counseling. For example, if I meet somebody on the road, I will invite them to come to the office, you know, give them literature, help persons out. Like, you know, some of them, they suffer with the ulcers and they're always in need of, you know, medical assistance, medical help. And we do the little that we can at the moment, yes.
Right, Dr. Bird, you have the final word. So what is the parting advice, your parting comments to the viewing public?
Sickle cell disease matters. Sickle cell disease is the commonest chronic disease that persons live with in St. Lucia. It's a genetic disease that you do not catch from somebody like an infection. It is passed on through the inheritance. So the more you know about your family history, the better you can protect your coming offspring from sickle cell disease. Early diagnosis is really what's important. And being part of the comprehensive care program that's offered by the Ministry of Health through the Community Child Health Service is a must. If you have a child or a family member with sickle cell disease and you are not registered with the association or in the Community Child Health Service, you are cheating your child because that is where cutting edge information will come through. And if we ever get to the point of being eligible for gene editing, that's where you'll get to know about it. So please register with the association, register with your Community Child Health Service at your nearest health center, and think about sickle cell disease and offer anything you have that you can to the association.
Dr. Jacqueline Bird is the Vice President of the Sinister Sickle Cell Association, and Sophia Harry is the President. So you have big shoes to fill. Good luck. We appreciate you being here, and our doors and cameras are open anytime you want to engage the public, so we are here for you. We appreciate you giving us the time, Dr. Bird and Ms. Harry. Thanks so much for being here.
Thank you very much, Bernard.
Yeah.
And we want to thank the viewers for being part of this. And again, learn as much as you can. It is critical that you know information. That you have information. You can visit all the wellness centers in St. Lucia, or you can find information, or the numbers on the screen they can call to get some additional information. So we appreciate you being here. Thank you for viewing.